We've talked quite a lot here on 774, not just on Drive, about the issue of not enough funding for mental health. And mental health workers in Melbourne walked off the job today. I don't know whether that has ended up affecting you. They marched to Parliament House because they want better conditions and pay. Paul Healey is the State Secretary of the Health and Community Services Union. Paul, hello.
Good afternoon. Good.
So can I just sort of clarify, first of all, you walked off the job. Are you still off the job? And who are we talking about?
So what we're talking about is mental health workers. So that's OTs, social workers, nurses, mental health nurses, admin workers and people with lived experience who work in the mental health system walked off the job today.
How many of you?
There was over 500 people attended the rally at Parliament today, and they're from all over the state. So we had a group drive from Hamilton, we had Barwon, Gippsland, Bendigo. So it was a real good turnout. Someone turned up from Warrnambool, so it was a big crew.
So what are you calling for?
So really what we're looking to do is for wages and conditions to improve retention and recruitment for mental health. Currently, mental health in Victoria, we believe, the staffing is about 2,400 short of what we think is required to build a strong and resilient mental health system. Also, we want it to be in line with the Royal Commission. We want to build a mental health system that is holistic and looking at well-being rather than just a medical model. We want to get back to the therapies and the things that make people better and well, and we want to look after all Victorians, because 1 in 5 people have a mental health episode this year, and we want to make sure we've got the right services at the right time.
So what is the government offering? What's on the table at the moment?
So currently on the table is the government's offering less pay for our nursing that they offer general nurses. So we want pay parity with the general nurses. Mental health is a specialty skill, but we want pay parity with the general nurses. Our allied health colleagues will be anywhere between $20,000 to $40,000 less pay, and oftentimes they do very same or similar work. So they're going to be up to $40,000 off over the life of the next 4 years. So we want that sorted out. We've got the lived experience workers. They don't have any structures and educators and support in leadership positions. We want that to be sorted out. And for our admin workers, we want a structure that actually encourages people to stay in the system.
So what next? What's the plan? And I should ask, I guess, Paul Healey, how much disruption has this caused to services today? I take the point that you wanted to make your point, but I'm guessing 500 people off the job would have left a lot of people short today.
Well, because it's right across the state, there is management and other staff that there to support it. So we always ensure safety first, and we make sure that there's minimal amount of disruption. What it really is just is send a message to the government. What we want is we want this sorted out. We've been bargaining for 11 months. We think that's long enough. We want the government to be really serious about fixing this issue. Nobody likes to take industrial action. People like to be at work. They do these careers because they love the caring and supporting of people through their journeys. So they don't want to do it, but we need to do it. We want it sorted out. We want the government to make a decent offer and sort out these issues.
So is there more marches, more strikes planned, or are you just waiting to see how the government responds to this one?
We haven't booked any in yet, but we will continue to push. We haven't taken any action on night duty. There's potential for more statewide stop works, and we'll also be doing some more campaigning through social media and media to actually try and highlight issues, but actually to sort it out. We know that mental ill health costs the state government $14.3 billion a year through lack of productivity, social services and other issues, but they're only investing 2.3, and we think they need to invest more to make a strong system to actually regain that money.
Paul, good to talk to you. Thank you.
Thank you very much. Have a good night.
Paul Healey there, State Secretary of the Health and Community Services Union.